Today is World Mental Health Day, an international day for global mental health, education, awareness and advocacy against social stigma. It was first celebrated in 1992 at the initiative of the World Federation for Mental Health. In Ekiti State, stakeholders and health experts are calling for the establishment of mental health centers across the country to cater for all categories of mental issues. Ayomide Ajeigbe reports.
The past few months have been challenging for people all over the world, with the COVID-19 pandemic changing our lives considerably, and with this, mental health has become even more important. On a day like this, it is not just about the folks who live isolated lives or the man on the street who has lost his mind. It is also about the young men who have taken to drugs and carelessly smoke M's in the full glare of the public. They have even devised several ways of concealing hard drugs to escape drug law enforcers.
They will pick this guy, search his bag. We saw this thing. Ordinarily, when you see this inside the bag, you will not suspect anything. But do you know that when we opened this, we saw heroin? It was concealed.
At this lecture organized by the Ministry of Health in Ekiti State in conjunction with the Office of the Wife of the Governor, mental health expert says no one is immune against mental sickness, as they provide insight to the issues surrounding this, with a proposal that government at all levels need to take this more seriously.
I am not a mental health expert. I am not a health professional of any kind, but I'm a friend of people who have suffered from different aspects of mental health. Today, our goal is not just to raise awareness of mental health issues, but also to begin a strategic process to develop and institute targeted actions for mental health care in Ekiti State. It is time for us to rise up and move from ideas to reality.
From the churches to the homes to the schools to various groups, this needs to be addressed. And very importantly, there are religious leaders that are depressed. There are heads of governments that are undergoing one mental health issue or the other. So it doesn't matter how good I look in the face, people have issues and we really need to address it.
Given the circumstances, it is expected that the need for mental health and psychosocial support will substantially increase in the coming months and years. Ayomide Ajeigbe, TVC News, Ado Ekiti.